VascuClose XF is a vascular closure system that is intended to rapidly seal the femoral arterial puncture site following diagnostic or interventional catheterization procedures. It is designed to precisely deliver a sealant to the outside of the artery at the arteriotomy site. The VascuClose XF uses a combination of both visual and tactile indicators for deployment of the sealant. No intravascular components remain following deployment. There are no sutures or permanent implants. The sealant is fully absorbed. It can be used for sheaths 4 French to 7 French. VascuClose XF offers disruptive technology in that it can be used anytime, anywhere. Unlike most competitor vascular closure devices, VascuClose XF has no limitations with its use based on the location of the puncture site, the size of the femoral artery, or the presence of atherosclerotic plaque disease within the femoral artery at the puncture site. VascuClose XF brings speed and simplicity to the vascular closure device market. The hemostatic agent is delivered in less than 30 seconds. It is an efficient and easy-to-use vascular closure system and has a rapid learning curve for physicians. VascuClose XF is expected to reduce time to hemostasis and minimize the need for manual compression, resulting in less time spent by post-procedural professionals, faster patient ambulation, and earlier patient discharge. Following the diagnostic or interventional catheterization procedure, an arteriogram is performed through the procedural sheath to evaluate the anatomy of the femoral artery access site. The procedural sheath is then removed over a guide wire. The VascuClose XF device is advanced over the guide wire towards the femoral artery until blood is seen refluxing out the proximal side hole of the distal reflux system. This signals that the distal side hole of the distal reflux system has entered the lumen of the artery. Resistance is met when the longitudinal ridges of the arterial stopper and the rigid proximal inner tube segment reach the outside wall of the artery. This resistance prevents the device from being advanced any further. No blood is seen refluxing out the proximal side hole of the proximal reflux system, indicating that the distal side hole of the proximal reflux system remains outside the artery. The injection side holes of the outer tube are now positioned just outside the artery at the arteriotomy site. The position of the device can be verified under fluoroscopy by a radio-opaque marker on the arterial stopper. The outer diameter of the inner tube segment that crosses the artery wall is matched to the outer diameter of the procedural sheath used during the procedure. In addition, the muscular layer of the arterial wall recoils around the inner tube segment that crosses the artery wall. This serves to occlude the arteriotomy site. The sealant is injected through the injection side port of the outer tube and out the injection side holes around the artery at the arteriotomy site. As the sealant forms an elastic coagulum, the VascuClose XF device is removed, drawing the fresh elastic coagulum along the percutaneous tract away from the surface of the artery and in the direction of the skin. Manual pressure is applied over the access site until hemostasis is achieved. Guide wire access can be maintained throughout the deployment of the sealant.